The coronavirus has clearly changed the way that we're practicing medicine, and cancer cells don't shelter in place, right? We've had to continue to provide cancer care during this entire time because it's an essential service and it's life-saving services for patients with cancer. We are able to adapt, such as when we have a global pandemic like coronavirus, to the daily changes that are needed, that we have a culture of hundreds of problem solvers, and that we are able to focus our effort on providing excellence in patient experience and minimizing the time to first treatment so that we can achieve the best outcomes, containing costs, and making sure that we provide safe and effective, compassionate care to everyone who comes to our door.
I originally found out about Rush Bone Marrow Center after I was diagnosed over at the myeloma clinic at Stroger. And so the doctor there immediately, when he told me that I had myeloma, also in the same breath told me basically that Rush had this outstanding program, and after my initial treatment, I could come here to have a transplant. I would go for my infusions once a week, and that helped me to process through the system so I could get the bone marrow transplant.
During the past few months of this extraordinary time, we've had many patients who've said that they were initially concerned about coming to the medical center to get their care. When they finally got here and learned of all the things we were doing to help keep them safe, they had the confidence to move forward.
I came back again after they had scheduled me for the transplant, and I asked the doctor, my bone marrow specialist, I said, do I really need this? You know, this is a very delicate time during COVID. The protocol and procedures that they adhered to every time, you know, to come into the building, sometimes it looked like I was the only person here. And that's how far apart they would schedule appointments for people.
Many times that's the journey of a cancer patient as it is. Knowing that you're in safe hands, knowing that there's a team behind you, that we've got your back, and that we're going to come up with a plan and execute on that to keep you healthy and safe.
That experience at Rush during COVID meant a lot to me because my life was on the line. How things are looking for me today after the stem cells, almost like, did I dream this? Because I have been doing amazing. I have, my doctor said to me one day when I came for the appointment, he said, Ms. Dyer, he said, you know, I hated I had to call you in for this boring appointment, but you're doing fabulous. And I said, you really like telling me that, don't you?